Hello everyone, I am Dr. Jagadesh Reddy. I am a cataract, cornea and LASIK surgeon at Pristine Eye Hospitals, Hyderabad. A lot of patients present to the clinic with earlier diagnosis of cataract. But when we go and examine the patients, we see different forms of cataract. Not all cataracts are the same. Depending on how a patient developed a cataract, the pattern of cataract can change. Depending on their genetic makeup, the type of cataract can be different. Depending on their lifestyle, the cataract can present in different forms. Each cataract can have different visual disability. Some patients with a particular type of cataract will be still able to see, but there are some patients with little amount of cataract, they will not be able to see clearly. So it all depends on the type of cataract. So initially we see in very young age, we see in children, these are called congenital cataracts. There are some types of cataracts in children which are non-progressive, they are very little and they don't cause any visual disturbance. We don't do any surgical interventions for them. But there are some cataracts which are very dense cataracts that present in kids. They prevent light from passing from outside into the eye, so the vision will not develop for these children. So these are the children where we would like to do a early intervention by performing a surgery, removing the cataract and implanting an artificial intraocular lens. There are some patients who present to us with injury to the eye. They develop a type of cataract, it's called Rossetti cataract. This type of cataract can be very simple to start with, it may not affect vision, but as the time progresses, this cataract can become more dense and patients would present with decrease in vision. These are called traumatic cataract, and we after examining the patient's eye completely to make sure there is no other pathology, we go ahead and do a cataract surgery to give them good vision. It doesn't mean that they had an injury, they will not have vision. By removing the cataract, their vision can improve completely. Radiation cataract. There are some patients who are on radiation therapy for their cancer treatments. When they are exposed to the radiation, the eyes can develop cataract. These type of cataracts are usually on the top of the lens. These are called anterior subcapsular or anterior polar cataracts. These cataracts, though they are very small, they cause significant decrease in vision. So these cataracts will require a removal. So we go ahead and remove the cataract and place an intraocular lens in these patients. Age-related cataract is one of the most common form of cataract. Even among the age-related cataracts, there are different forms. So one of the most common form is called a nuclear cataract, wherein the cataract develops in the center. So this keeps on increasing in density, it becomes hard as time progresses, and then patient will require surgical interventions when the amount of light that is transmitted to this cataractous lens decreases with time. The second form of cataract is called posterior subcapsular cataract. This usually develops in the center. This is small, but it can have a significant amount of visual impact. When a light falls into the eye, the pupil which is in front of the cataracts becomes small and the light goes only through this cataractous lens. And this type of cataract usually presents at a younger age group. People are mostly 35 to 45 years of age, and they would have difficulty in bright lights, bright sunlights, and when they are driving at nights. So they will not be able to see anything that is coming opposite to them. They cannot recognize faces of people in bright sunlight. So these patients, though they have smaller amount of cataract, they will require early surgical intervention. And other types of cataracts are cortical cataracts. It usually presents as spokes from the sides towards the center. This is mostly seen with diabetics and some systemic diseases, and this cataract can be associated with nuclear cataract or posterior subcapsular cataract. So the treatment of cataract surgery would depend on which type of cataract they have, and time of cataract surgery, and also depend on what type of cataract they have. And also we also look at how much visual disability they have with the different types of cataracts, and then we intervene surgically. All types of cataracts will require surgical intervention at some point of time, wherein we remove the cataract and implant an artificial lens, and they would have restoration of complete vision after the procedure is done.